Good morning, folks. This is my first YouTube video ever, and I'm happy to be with you this morning and share some information. My name is Jeff Calley, and I'm a licensed clinical alcohol and drug counselor and a licensed professional counselor. I have been in the field since 1997 and am in private practice since 2005. I just wanted to share some things that I thought could be helpful for the general public. Um, it is currently December the 18th. We're in the midst of the pandemic, and unfortunately, it's really taking a toll on people's emotional and mental health. Um, as gauged by the great need that I've been seeing as far as phone calls and people trying to access assistance and support. And I just wanted to touch base in reference to psychotropic medications. When I got in this field way back in the day, I came into the field somewhat naive and a little green in reference to knowledge. And, over the past 23 years, in talking with in excess of 1,500 client cases, my patients and their experiences have taught me very valuable lessons. And when I first got into the field, I was more under the impression that psychotherapy, community support, better communication with family members, and support from family and friends were the most necessary things for one to get to a good place and get well. And although I believed in medications, of course, I wasn't a very big advocate for psychotropic medications at the time. And I just wanted to share with you that this has significantly changed for me over the years. What I have come to realize is that, our brain is just another organ in our body. And it's the most important organ in our body, from my perspective, because it's the command center. And it runs all the other organs according to how our brain is functioning, and the messages and the signals that it sends to all the other organs in the body is according to how we function in the world. And unfortunately, sometimes, just like any other organ in our body, it needs medication. A great example that I heard when I first came into the field from a supervisor of mine was, would you tell a patient who had diabetes to not take their insulin? And, that made a lot of sense for me, recognizing that insulin was what kept them alive, basically. Now, I don't want to make any judgment as to what medications for the brain are that essential to keep one alive. However, I will tell you that what I have seen over the years is medications really doing miraculous things for people. And I'm very grateful for the psychiatrists, for the education that's getting out to the public, and for the shame and the stigma of maybe having to take a psychotropic medication in order to treat that organ we call the brain. Because, as I said, it's just another organ in the body. And, we've often neglected it because of old beliefs, because of this thing called the ego, this other thing called pride, a word that's very powerful that I learned about many years ago called shame. Many people resisted medications and continue to resist medications for the brain, and I see them suffering. And I just wanted to touch base and tell you my beliefs that the brain is like the computer in our ultra modern cars these days. Every time I take my car to the mechanic, I think of brake job, oil change, that kind of thing. And the first thing that they go to now is the computer, because just like the brain in our bodies, it's the thing that runs all of the other mechanisms of the car. And that's where the diagnostic takes place and where they have to start. So I like to just share in a very basic, common, understandable way some of these things that I've learned by being in practice all these years that I think could be helpful to you. And my next video will be in regards to more specifics around my experiences with people taking medications, some trial and error that is necessary at times, common side effects that scare people, and bad experiences people have had from medications due to either lack of education or being misrepresented in reference to what the medication is going to do for them. So I'll try to focus on that in my next video. Okay, uh, well, this was great. Exciting to put out my first YouTube video, and I hope that I was helpful for you. Everybody have a blessed day and a nice holiday season. Thank you.